So awesome. All right. Good morning, good afternoon, good evening, depending on where and when you are watching this Facebook Live. This is the voice and the face of Dr. Tolu Olabinto, CEO, founder of Living Spring Family Medical Center here in the awesome city of Mansfield, Texas, where we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. I am excited today to have the one and the only Dr. Tony Nguyen. Did I pronounce that right?
Yes, you did. And
I
there's
did.
many terrible ways to pronounce it, including Nguyen is probably the worst. But Win, you're right on point. Great job.
Also, thank you. Thank you for coming. I know you're busy and I appreciate you taking the time to come on.
Absolutely. Would not miss this because you are my doctor.
Awesome. All right. So today we're going to be talking about the phrase, Doc, I like to keep my teeth when I'm older. What can I do? For those of you who are watching live, please hashtag live. For those who are watching in replay, hashtag replay. So, Doc, I already introduced your name, but kindly introduce folks who are watching. Who are you and what do you do?
Yeah. So again, my name is Dr. Tony Nguyen. I am a general dentist here in Midlothian, Texas. And our practice is a little bit different that we practice very healthy holistic dentistry in Midlothian, Texas. And what that means for us is that we really focus on the link between the oral and systemic health and how it plays together of looking at a patient's physical health, their mental health, their spiritual health. And we're not here just to fix teeth. We're really here to, like you, Dr. O, supporting people to have the greatest lifestyle and living their life to the maximum, the passion, the work, the relationships, the health. And so that's what we're focused on here at Legacy Dentistry.
Awesome. So you're it's like a holistic approach. I love that, and clearly your teeth is important for living long and well. So awesome. I like what you do. Now, why do you do what you do? I'm curious. Well, our viewers are also curious. Why dentistry? Why did you go in this route?
So for dentistry, I always say that I did not choose dentistry initially, but dentistry chose me. When I was in school, my mother, she raised five of us. She was one of the sole, financial breadwinners for our household. And she was just responsible for a lot. And she always put herself in the very back burner when it comes to health. And she didn't see a dentist till probably the age of like almost 40 something years old. And we have a long span time frame where we just didn't have any pictures of her. We didn't have any pictures of her smiling. And one day she was just like, hey, kids, I'm thinking about, fixing my teeth. And my brothers and I were like, yeah, do it. Yeah, like we fully support you. It's your time to take care of yourself. We still had younger brothers and sisters, long story short, but she just never invested in herself. She didn't, she always put the children, everything else, the business, the life on the back burner. And so after she got her work done and she had our family and Asians, a lot of Asians do suffer from periodontal disease and very severe periodontal disease. She also suffered from that and lost multiple teeth, had to have many teeth extracted, several implants placed. Anyway, long story short, she had amazing transformation by getting that dentistry done, and it changed her life. The way she cannot stop smiling, she cannot stop taking photos, she cannot stop talking to people, enjoying life, and making the decisions to continue to invest in herself. And so seeing that was one of my first exposures to the impact of dentistry has on someone's life. And at the same time, a couple of years later, I was in college. I was raising my my first son in college with my wife, Tao. We've been married for about 15 years. And I had this reoccurring dream. I was going to medical school. I was planning to go to medical school, and I was working in the ER, and I was about to take the MCAT, and I'm studying for it for several months. And I kept having this reoccurring dream, Dr. O. I kept having this reoccurring dream that I would speak to someone, my tooth would loosen, and it would fall out. And I'm just like, in the dream, I didn't hear words, but I could feel the anxiety. I can feel the fear. I can feel the shame and the guilt and despairing. And that tooth came out, but not just one. Another one came out. Another one came out. And then next thing I knew, I had this waterfall of teeth that was coming out of my mouth, and I would wake up in cold sweats for like weeks on end.
Wow.
And so, long story short, I was just like, okay, maybe this is God's sign that says I'm supposed to go to dentistry. And I just kept getting more exposure. I met so many mentors that were dentists. I was like, okay, I gotta just give in here and go with what I'm feeling. And the dreams stopped. And ever since then, I've just been like gung ho on not only just dentistry, but just allowing people to have that second chance to really have passion in their life and excitement and health and invest in themselves and love themselves. So that's how I got into dentistry. And so I'm here now at Legacy Dentistry. It's been around for 10 years. I took over and transitioned about 3 years ago. And I've been just enjoying the process, just enjoying the journey, serving my patients, building relationships ever since.
Awesome, awesome, awesome. And I gotta tell you, I can't tell you enough about people, even loved ones, and patients and people I meet who have beautiful smiles, but because of how they feel about their teeth, they don't show it. I'm just like, oh man, if you'd only know how beautiful your
Yes.
smile is. Thank you for what you do. Now, first question though, how can we prevent gum disease? You mentioned periodontal, but let's talk gums. The red stuff that kind of holds the teeth in place. How from a preventive standpoint, what would you say to someone who's watching? What are things I could do to prevent gum disease?
Yeah. And I just want to a note here. For a lot of our patients do not see us until they have a dental emergency. Okay. Dental emergencies are really what initially brings people in, because periodontal disease, gum disease, most things in dentistry are completely painless. The disease process is chronic and completely
Mm,
painless. So by the time it has taken effect, most of our patients have already lost a tooth from that when they first see us, and which really stirs and initiates the whole healing process. But there's so many things that cause periodontal disease and gum disease. It's really a chronic inflammatory disease. Okay, it's an inflammation. And what happens there is the inflammation will eventually deteriorate the bone around the tooth, and the tooth loosens and falls out. The only way to really prevent periodontal disease, which 90 for about, I would say about 50% of 50% of adults 30 years and up have periodontal disease, and they do not know it. They
mm,
have some level, mild, moderate, or severe. The only way to prevent it is maintenance and seeing a doctor twice a year so that we can catch it on early. If we can catch it early, we can slow the disease process, but we can never get rid of it. We cannot get rid of periodontal. A lot of patients will say, "Well, I just had my cleaning and I thought it was good. I felt great, and I was all right." But they come back several years later and they lose a tooth. It's because it doesn't go away. It needs to be maintained and slow down that progression. Um, and so, by a couple of ways to prevent, obviously, see your dentist on a normal basis.
mm,
At least twice a year, at least twice a year. Many of our patients see us 3 to 4 times a year if they have active periodontal disease. So,
wow.
seeing a dentist, getting gum treatment, which sometimes requires laser treatment, deep scaling and root planing, cleaning underneath the roots, is one way to slow that progression down. But breaking up biofilm, breaking up anything around your teeth,
Mm,
breaking up any of the bacterial load in your mouth will help slow down the progression of periodontal disease. Flossing twice a day, brushing twice a day, using oral mouth rinses, using a water pick. All of these things will help support you into not losing your teeth through periodontal disease. Um, those are just kind of a couple of tidbits, and we can go all day and go really deep and really long with this, but this is just a general breakdown. The suggestions we've always recommended to patients still hold true.
mm.
They still hold true.
Awesome. And it's so funny. A lot of patients that need that don't go for dental appointments, but have dental insurance, especially. So it's really important. Prevention is key. Flossing, using mouth rinses, water pick, brushing twice a day, and going for your checkups at least twice a year. And the truth is, mouth. We know that oral health is also linked to overall health. In fact, I remember when I was taking classes for I was seeing OB patients, pregnant patients. It was very important that they see a dentist to minimize the risk of early pregnancy, early labor, or premature birth in the baby. So it's very, very important. Your dental health is actually very important for your overall health. Next question, Doc. Um, what type of toothbrush and toothpaste should we be using? Like, what would you recommend, generally speaking?
Yes. So to start with the toothbrush, a lot of our patients will say, I use the really hard, firm toothbrushes because I feel like it really cleans my teeth well. That's a very normal, common thing that is told to us. Really, what you want to stick to is very soft, bristle toothbrushes. It's not about how hard you go, it's about the technique that you're applying during the cleaning process, cleaning around the gums. Using a soft bristle toothbrush will really keep you from abrading away the superficial portion of your teeth, which is the enamel, and also keeping you from creating these little called abfractions. So if you check your teeth and you see these little wedges between your gum, and it's like little moon shapes, that's called abfractions. They're usually caused by really heavy clenching and grinding or very aggressive toothbrushing. And I have them myself because I did not know that when I was younger. And I had a really bad toothache when I was younger. And it hurt so bad. And I was like, I'll never get a cavity again. So I got a hard toothbrush and I would just go to town on my tooth and gums. And so I have a pretty significant recession and abfractions on my back molars from that experience. So I am definitely not guilty, but I have the impacts there. So that's one. I would recommend an electric toothbrush. Any electric toothbrush is great. I personally recommend most of our patients to use a Philips Sonicare toothbrush, just because of the vibrating power of the toothbrush and bristles. It really breaks down the biofilm and gives it your teeth and the tissue a great cleansing and cleaning. So that's with toothbrushes. When it comes to mouth rinse, it's really case by case. We hear a lot about, hey, non-Listerine base versus non-alcohol versus alcohol base, and the risk and benefits of using each of those.
Okay.
I will let you know right now. One that we recommend to our patients is rinse well with Boca, as it has hydroxyapatite in it and also xylitol. So it's a fluoride-free and it's a alcohol-free mouth rinse that will help our patients not only maintain healthy bacteria in their mouth, but also kill off the harmful bacteria that causes odor in the mouth and plaque buildup, and it also kills the bacteria that causes periodontal disease. But I can go to town on it, and really you have to talk to your doctor to see what's the best fit for you, because Listerine-based toothpastes are not great for patients who maybe have dry mouth, who have cancer, or have gone through cancer, or immunocompromised, or because for a number of reasons, including it dries out your mouth. Can also cause oral yeast infections as well. It kills out all the bacteria in your mouth, not just the healthy ones, the bad ones, but the healthy ones too.
Oh, wow. So try to use the alcohol free. Of course, these are medical suggestions. See your dentist, and he's taking patients to come up with a plan that's unique for you. So be careful about alcohol based, not washing, because it can dry the mouth and actually increase your risk for infections. So very, very important to note. Doc, let's talk toothpaste. All right. What are your suggestions, generally speaking?
Oh, sorry, that was my toothpaste. So that last one was the toothpaste. The Rinsewell Boca was the toothpaste. And the mouth, yes, my apologies. I jumped ahead there. So just want to lay that out there for that toothpaste. Okay. So the mouth rinse was the Listerine versus non-Listerine base. Okay.
Wow.
Yes. So alcohol versus non-alcohol. So Listerine can have alcohol, and if you can find one that's non-alcohol, that's a great option. Bioteins are also a really great options for non-alcohol based mouth rinses.
All right, awesome. I'm taking notes. How you guys are taking? I'm taking notes for my teeth.
Yeah.
I love to smile. All right, Doc. Now, what foods would you say, generally speaking, are bad for my teeth?
Yeah. So this is a great question. Let's start off with how cavities form. Most people assume, hey, if I eat candy, I will get a cavity, right? So there's assuming candy causes cavities. It's really not the candy itself. It's the acidity that it creates that causes cavities. So cavities are formed through acidity. So what that would look like is when you eat candy, or any type of carbohydrates, including chips, if it's left there, bacteria in your mouth will begin to consume that as food, and then they secrete, or like what we tell our kids, they poo-poo on your teeth and create a very acid. It also It'll also drop the pH in your mouth as well every time you have anything to eat, including anything acidic. So the acidity is what really causes tooth decay. So know that we are all human and we all have sugar here and there. We all have things, sweets that we may consume occasionally, but things that increase that risk are things that are carbohydrates in base, anything that creates acids, are also put your teeth at risk, even water bottles.
What do you mean by water
Yeah.
bottle? Explain that one.
Yeah. So even water bottles have a low pH. Like Dasani will have a very low pH, and Ozarka has a low pH as well, about a 4. So it's actually more acidic than even drinking coffee. And once you pass the threshold of about 5.5 on your pH, your teeth are now soft.
Oh, wow.
Okay. So your teeth are already soft. And when it's soft, it's just easy to get tooth decays. And it takes about an hour for that pH to jump back up. And the longer you drink it, the longer it takes your pH to jump back up. So things that are very healthier for you are going to be obviously your apples, your fruits, your vegetables, all of the things that we have been told that are healthy for us are healthy for us. It's just we have to understand how the disease process occurs. And a lot of us right now in a day and age love drinking coffee throughout the day. We love having a quick, those big gulps, or, any drinks that we have and we sip it throughout the day. And then we're drinking it for like 2 hours, like a Monster or a Red Bull or a green sweet iced tea. If you drink it and it takes you 3 hours and it takes you an hour for your teeth to rebalance again, you're soft for like 4 or 5 hours. The risk of having a decay is you've just expanded that time frame significantly. Yeah.
Wow.
So yes, eating good, healthy food is awesome, but every time you eat, your pH drops slightly, right? It drops slightly. The more acidic, the more high carbohydrates, chips, snacks, candy, green, sweet tea, anything like that is going to cause you to have a higher risk of getting a tooth infection.
So do fruits and vegetables keep your pH balanced?
Yes, it will actually keep your pH balanced. Yeah.
And I thought so. I just wanted to just friendly reminder there.
Yeah.
Fruits and veggies are good for a lot of things.
Yeah.
Awesome, awesome. Now, so that being said, would you say that it's better to try to drink through straws? Because then you bypass the whole sipping through that bottle. I didn't know that. That's interesting.
Yeah, yes, it's very uncommon, but it is a very well-known studies on the pH level. You can always get a pH litmus paper, test it in your water, and see.
Wow, good to know. Thank you. This is very, 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 very big stuff. Awesome, awesome. All right, so one more question for you, Doc. So, what are red flags to kind of watch out for? And by this I mean, okay, my teeth hurts, not hurting too much. Maybe I don't need to do anything about it. Like, what are other red flags that you say you should go see your dentist right away?
Okay,
What would
great.
you get top four or so?
Okay, yeah. So I will let that's gonna be a hard one, but let me try to break this down. If you have any type of sensitivity on your teeth, any type of sensitivity, if you're drinking cold water and you go, that feels a little cold. It might stay very long. It might not stay very long. Okay. If it stays very short, very brief, chances are you have some level of periodontal disease because maybe you have recession there. Now your roots are exposed. So when you drink anything cold, anything that varies in temperatures, you're like, that didn't feel too great. I really can't bite into some ice cream or something like that, or have a smoothie. It just feels a little bit cold. Chances are you might have some recession there. So you're gonna check with your doctor, make sure that you don't have active periodontal disease. And I would say if you're having pain and sensation that lingers, that's a definite huge red flag that you're in a lot of you're in big trouble. Okay. If it lingers, if you drink something and it's just like, wow, it's still hurting after about 20 seconds, I can still feel it. I can feel even the pulse inside of the tooth, like a blood pulse. Chances are the tooth is severely infected and need treatment as soon as possible, before the infection gets worse.
Awesome, awesome. Thank you so much, Dr. Nguyen. Now, people are wondering, I heard Legacy Dentistry, but where can people connect with you to see you as a patient, to have you maybe come give a talk on dental care? Where can people contact you, Doc?
Yes, you can contact us multiple different ways. We're on Facebook. Just look up Legacy Dentistry. We'll pop up there. You can contact us through our phone number at 972-723-1148, or go on our website at www.legacydentistry.com, and you'll learn more about us there, how we practice, what we focus on. And you can also schedule for an appointment directly on that website. So multiple different ways. Facebook, you can look us online, website, you can give us a call, and we'll be more than happy to take care of you guys. But the most important thing is take care of yourself. See me, see someone, see anyone, so that you're not in a position where it's starting to affect your standard of living.
Awesome, awesome. Thank you so much. Words of the wise. And we've already posted those information for our viewers who are listening live and in replay. I really appreciate you coming, Dr. Nguyen. Thank you so much.
My pleasure. Hey, have a great Friday, guys.
Awesome, awesome, awesome. On that note, if you or anyone you know is looking for an awesome, a passionate, and a thorough family physician in the Mansfield, Texas, and surrounding area, I am she. Have a good one. Happy Friday, guys.
Bye, guys.
Bye.